And it is my pleasure in the WellMed Charitable Foundation Teleconnection Series to introduce Lucy Barylak, who is one of our major presenters, who is always pretty amazing to listen to. Has a fabulous background, and I'm going to tell you a little bit about it. She received her master's degree in social work from McGill University, dedicated her career to supporting caregivers. Lucy was the founder and long-term manager for the Caregiver Support Center and a respite program for family caregivers, where she oversaw multidisciplinary training across caregiving, mental health, elder abuse, and palliative care. Excuse me. In 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association, awarded for her dedication in developing a national coalition to support caregivers. And she's been a key architect of screening and assessment tools of family caregivers and provides training to professionals across North America. Lucy also consults for private industry, including WellMed Charitable Foundation and their clinics in Texas. And she's a liaison supervisor at the School of Social Work at McGill University, where she supervises 20 interns in addition to everything else that she does. So Lucy, we're so proud and happy to have you. Thank you so much for joining us today. Please go ahead, take it away.
Thank you, Evelyn. Thank you, Minerva. Thank you, everyone, for joining us today, for joining all of us. I want this to be a kind of informal discussion. So from time to time, I'll ask you if you have questions and as well, if you have an opportunity, you will be receiving the slides. There's a lot of information on it. So I don't want you to worry about that. But if you do want to get paper and pen, if you have any additional questions, so by all means. One of the biggest challenges, as Evelyn said, is that caregivers face on a daily basis when someone with dementia is refusing personal hygiene care. It's extremely frustrating. I receive a lot of emails from caregivers about this particular topic, and I wanted to share one of them with you. And this person writes, "Dear Lucy, my husband was diagnosed with Alzheimer's 5 years ago. I'm his primary caregiver and happy to do so. In general, George is a very calm and gentle man. I assist him in all his daily activities. However, in the past few months, it has become very difficult to care for George with his hygiene. He's now refusing to bathe, change his clothes, and refuses to brush his teeth. I'm so angry with him that I just want to give up. I don't know what to do or where to go to get help. I took him to his doctor, who said that dementia has progressed and that I need to find new ways to assist George. I'm in my late 70s and I find it very difficult when I get angry. I feel sorry for yelling at him. Please help." And this is just one example of what caregivers go through. And so I want to say to the person who sent it, thank you for your email. And I'm truly sorry for what you're going through and what George is going through as well. So what I would like to do is to always remind ourselves, let's look a little bit, what is dementia? Even though you might know and you've researched it, why is it important to think about it? It's because it's there, and all these behaviors are due to the disease. So if you can change the slide, Minerva, thank you. So very briefly, just a little reminder, what is it? It's a set of symptoms caused by disorders affecting the brain. And just to elaborate a little bit, dementia is the umbrella of many diseases, okay? Could be Alzheimer's, Lewy body, front lobal. So we kind of say dementia, but there's diseases that go under it. So we know that there's memory loss, difficulty with thinking, problem solving, and language. Their mood can change, their behavior can definitely change, and obviously there's reduced ability to perform everyday activities. And it's a symptom, it's irreversible, and it progresses. So, keeping that in mind is very important to remind ourselves, because what we're dealing with is a sickness. It's not the person's fault, even though they may not want to do what you want them because it's important. It's the disease that's really affecting their behavior. So let's discuss reasons why some people with dementia display difficult behaviors, especially when it comes to daily hygiene. It might be a behavior that always existed, they may not always wanted to, take a shower as often as need be, or it's a new situation that as a caregiver, you're now facing. But remember that when a person with dementia is unwilling to do something that we want them to do, this may be described many times. We look at it as they're refusing, they're resistant, they're difficult to manage, they're stubborn. If you think in that way, that can make you very angry and frustrated, and I can understand why. However, as with other areas of a person's behavior that we may find challenging or distressing, we need to try and find out what the person is telling us through their refusal. In other words, we need to try to find out what the person is telling us, okay? What is the reasons? Why are they refusing? Rather than expecting the person with dementia to follow our wishes, we should be focusing on how we can cooperate with their wishes. Now, I know that might be asking a lot of you, but I'll tell you, if you take that kind of way of thinking, it's going to be easier for you in the long run. So if we can turn to the next slide. So let's see, what's actually happening, okay? A person with dementia is verbally or non-verbally communicating that they don't want, they don't want to do something that you're asking them to do. So let's take a look at some of the reasons behind that. The person may be in pain or have a medical condition that you're not even aware of. And actually, they can say to you, it's hurting me. And so they can't express it. The person does not understand what they are being asked to do. And it's a reality. They have dementia. They might not understand what you're saying. The request we're making does not fit with the person's standard and preference. For example, we're asking them to eat something that they don't like or asking them to go to bed when they want to stay up. And many times this kind of behavior happens in the early stages where they're still aware of a little bit of what's going on. And the person feels that they're being talked down to or bossed around and refusing in order to keep a sense of some sort of control. The person is misinterpreting the situation or environment. For example, the person may perceive a shiny floor as being wet and refuses to walk on it. I'm going to talk about perception, about sensory perception. It changes, but they cannot tell you why. So what you're seeing is a resistant person, but in the reality, something might be going on that you're not aware about. They could really be only tired, they could be hungry, and many, many times, they need to go to the bathroom. And that's why their behavior is in such a way. Now, a person with dementia may refuse to fit in with your daily routine. This can be seen as a positive sign. Let me tell you why. It may show that the person still has a sense of their own identity and autonomy and wants to maintain some control over their lives. It's very beneficial to both you and the person you are caring for to maintain their autonomy and dignity for as long as possible. And sometimes it's frustrating because it takes time and patience and energy. But people with dementia have good days and they have bad days, like all of us. It is so important to recognize how the person is feeling that day. If they're having a bad day, maybe it's not a good idea to give them a bath or shower. Pick your battles and focus on the quality of life. Personal care is an intimate activity, and most people will experience difficult feelings if they need help with hygiene. I remember that with my mother very clearly, and we were extremely close. But there's a shyness, there's an uncomfort when somebody is actually helping you with such intimate activities. So trying to force a person with dementia to accept personal care may be seen as abusive. However, neglecting someone's personal care needs can also be seen as abusive. So what does a caregiver do, and how do you move forward with such a difficult situation? So let's go to the next slide and let's look at that a little bit further. Okay, so we're trying to provide care, right? Is a form, with dementia. And remember, sorry about that. I'm so sorry about that. I have to kind of clarify what happened here. My daughter and my son-in-law are in Dubai and they were FaceTiming me and I didn't close my phone, so I apologize. Okay, so providing care takes tremendous patience, creativity, and empathy. And that's a reminder we have to remind ourselves all the time. The ability to step outside our personal needs and logic to understand why a certain behavior is happening. First and foremost, remind yourself that providing care for someone with dementia requires a lot of patience. The ability to step aside of your personal needs and logic and to understand what's happening. As with most things related to dementia, caregiving, dealing with behavioral symptoms requires a lot of planning, making things simple and patience. As dementia progresses, poor hygiene can become an issue. People living with dementia may refuse to bathe, and it can have medical consequences, such as urinary tract infection. They can get rashes or bed sores or unpleasant odors that are not a pleasant thing to be around. So again, I was saying that sometimes you have to really balance things out to make sure that things are being taken care of. Because dementia causes a slow decline of cognitive functioning, the individual will start to get confused about simple things, like how to wash their hair. They may be overwhelmed and confused by all the products on the bathroom counter, perhaps mistaking a tube of lotion for toothpaste. They may not always recognize themselves or their loved ones. The image they see in the mirror may appear to them as strangers. So I always encourage, and I know it worked as well because I was a caregiver for my mother for over 10 years. I used to unclutter her bathroom, especially so that she didn't get confused with the toothpaste or the lotion. And keep in mind that even a mirror can make them feel very frightened because they don't recognize the person in the mirror. So all of a sudden, they're behaving very strangely or wanting to get out of the bathroom, and you don't know what's going on. For some caregivers, they even, if that's the case, if they recognize that that's the problem, they will actually put something over the mirror. But these are things, this is like everyone has to kind of know who you're caring for and what are their needs. So if we can go to the next slide, please. Remember, I was talking about sensory perceptions, okay? And sensory perception changes with aging. I'm wearing glasses, right? So as I'm aging, things change. Sometimes you need hearing aids. But with dementia, it's even more important to recognize that. So normal aging, there's vision, there's touch, there's smell, there's hearing, and there's taste. So you could just imagine if someone has dementia and has some of these losses, how it affects their daily life. So for example, a tub of water may seem scary as depth perception changes. They don't recognize, they don't know what's there. And this one comes from a caregiver because they said, they recognize that a smelly shirt may be more comfortable than a fresh one because it's just kind of comforting to the person. Now, water temperature may feel different for them than for you. It might seem colder or hotter. Here's a little tip. If you want to kind of gauge what the temperature of the water is, put your elbow in rather than your hand. I don't know why doing that gives you a better perception of the real water temperature. Now, the other thing is not knowing what's happening to them, feeling very, very confused, not able to hear your instructions again, hearing loss, taste changes, could be loss of taste as well. So perception is important, So if you're doing, make sure that the person, if they're wearing glasses, the glasses are clean. You could take them for prescription, making that the prescription is up to date. Hearing aids are extremely important. Maybe they're uncomfortable, but just to make sure that they're wearing all the aids that they can. Now, can we go to the next slide, please? So how do we start? Okay. Helping someone with dementia take a bath or shower could be one of the hardest things to do, as I said. Planning can help make bath time better for both of you. If the person is afraid of bathing, follow their lifelong habits, like maybe they would took their shower in the morning or in the evening, so try and do it at the same time or before bedtime. There's no magic formula because each person is different. When I say make sure that you have time and energy to get the task done, is that what I'm saying? If you're waking up that day and you're not having a great day and you're tired and you're not patient, maybe it's not a right time to do it. Be prepared that things may not work out as you wish. Have that in mind. You're trying to do the best you can. Again, I'm going to be using this. Be patient. Use clear words and maybe sometimes even talk a little bit louder if you know that they have a hearing problem. Don't get frustrated or angry. Your body language tells a lot. Sometimes you don't even have to say anything. You just look at them in a certain way and they can maybe feel that you're upset, but they don't know why. And obviously staying calm and focused is really, really important. I'm going to be talking about bathing, and once I finish talking about bathing, I'll open it up to questions before we go to the next topic. So let's go to the next slide, please. So what I'm talking about here is bathing and safety tips. Now, never leave a confused or frail person alone in the tub or shower. Now, I know my mother used to say, don't come in, but I used to say at the door. So don't answer the phone if it rings wherever, stay there because it only takes a second for someone to really fall and hurt themselves. Again, it's always important to check the water temperature. And you can use a handheld shower head, use a rubber bath mat and safety bars in the tub, use a sturdy shower chair to support the person. You can find these equipment, but what I want to tell you, I would rather you have the person evaluated at home. Now you can have someone come in, a physiotherapist or occupational therapist, and that's important so that the rails and the bars and everything is put at the right length. Now, I think what also, it's your mannerism also. I think it's important to be matter of fact about bathing. Say things like, it's time for a bath now. Don't argue about the need for a bath or shower. Don't tell them, you're dirty, you're smelly. That's not going to resonate with them. Just being very matter of fact. One caregiver told me that what worked for her mother was she would say, we're having a spa day today. Okay. So this was something that was very relaxed. And again, we have to be gentle and respectful, tell the person what you're doing step by step. It's important to do that. And make sure that they also are having a good day. Now, don't use bath oil. I'm sure you would never do that. It could make the tub very slippery. And believe it or not, cause urinary tract infection. And even if it's not oil, it's all these things that we put in the bath. Don't put any of that in the bath. It can be irritating. But if they refuse to bathe or shower that day, a sponge bath may be helpful. Now, the other thing that I want to talk is that during the shower, if we can change to the next slide, please. Now, before the bath, get the soap, the washcloths, towels, and shampoo ready. I'm going to talk about shampoo. Baby shampoo is very good to use because it doesn't irritate the eyes. Now, make sure that the bathroom is warm and very well lit, okay? That we know is important. For some people, one of them, caregivers told us, playing soft music really helped the person to relax because you're kind of creating a little bit of a spa. And as I said, be matter of fact, be respectful, and all the things that I just talked about. Now, the other thing is that I also want to kind of put the towel, the other, oh, yeah, we can go to the next slide. So it has a little bit more details. Now, the other thing is, remember I said that try to maintain their autonomy for as long as possible. It does take more time and patience. This protects their dignity, and it's important for them to do as much for themselves. Now, you could put a towel over the person's shoulders or their lap. This helps them feel less exposed. Use a sponge or washcloth to clean under the towel, or give it to them to clean themselves as much as they can. Now, the other thing that we always talk about behavior, when somebody is displaying, when they're getting agitated all of a sudden, distract them. It works. What do I mean by that? Talk about something else, and get their attention. Look into their eyes. Now, the other thing that I also want to talk about is a little bit more private. We want to prevent rashes or infections by, it's very important to make sure that the person's skin is dried out. You have to pat it down. Make sure it's completely dry. Be sure to dry between the folds of the skin. If the person is incontinent, use a protective ointment that you can get from your drugstore. Always ask the pharmacist first. Anything you buy over the counter, I really highly suggest you ask the pharmacist. And, and put it on their private parts. And if they can do it themselves. The other thing is, for most people, a full bath or shower 2 or 3 times a week is enough. These people are not going out, they're not working, they're mostly at home. It's a different way of perspiration. Between full bath, a sponge bath to clean the face, the hands, the feet, the underarms, and the private parts is all you need to do on a daily basis. The other things, very quickly, washing the person's hair in the sink sometimes with a hose is easier. For some caregivers, that's a tip that they felt that was very helpful to them. Now, again, use shampoo, non-stick baby shampoo, but there's nothing wrong with getting, there is the spray shampoo that actually works. It's a dry shampoo. But if things really become very, very difficult for you, in showering especially, think about possibly hiring private help, especially if it's becoming too difficult, if it's physically too difficult for you. So what I'm going to do now is I'm going to open the microphone if anybody wants to ask questions, because I said a lot. And if you have your own tips, please share with us. It's really, really very helpful to everybody who is with us today.
So, folks, this is your opportunity to talk to Lucy, our dear Lucy. If you want to talk to us and you're on the phone, just press *6. If you're on Zoom, you can go to the chat room, you can put your hand up, or you can simply unmute yourself. I can see on my little computer website who's opening up and who would like to share with us. Don't be shy. We love your input. Love your input.
Yeah, it's okay. Just think about that. I know it's not easy.
Lucy, I wanted to say one thing about, when you were talking about letting people make their own decisions as much as possible. I was on a call with Dr. Barry Jacobs, who's a very busy medical consultant as well as psychologist who does private psychotherapy. And he has a 92-year-old mother who refuses to use her walker and keeps falling down. And he keeps saying, "Mom, you got to use your walker." And she says, "You are not my boss."
Yeah, that's a big one,
And so she falls and he has to take her to the emergency room for hours.
I know it's so much easier to have them, go along with what the needs are. You need to have a shower, you need to be clean for many different reasons, not just for hygiene only, like for odor, but for your skin, for medical reasons. So it's not easy. Look, if I hope that I've answered some of your questions and your tips. I will continue, but if you want to go back later on and ask some the same question about showering or bathing, I'd be more than happy. So my next topic, I'm going to talk about dressing. This is a big issue as well, so we can change the slide. People with dementia often need more time to dress. And some people who get older need a lot more time to dress. It can be very hard for them to choose their own clothes, okay? They might wear the wrong clothes for the season. They also might wear colors that don't go together or forget to put on a piece of clothing. And again, allow the person to dress on their own for as long as possible. Does it really matter if the clothes don't match, if they're home? Does it really matter? And as I just said many times, choose your battles. So having said that, I think what is important really is that it's important to lay out the clothes. Now, again, patience comes into play and time, so if you're in a rush, give yourself the time. If you're going out of the house, if you're staying in the house, okay, let them put on whatever they want. But if you're planning to go out and you want them to look nice, and it's important that they are dressed properly for the weather as well, lay out the clothes in order it should be put on. For example, you put the underwear first, then the pants, or then the skirt and the sweater, whatever it is. And it's also important to hand the person one item at a time or give them step-by-step instructions. Now, you could also put away some clothes in another room to reduce the number of clothes. Keep only 1 or 2 outfits in a closet or dresser. Now, this might sound strange to you, but it worked for my mother. My mother loved clothes. She really loved to dress up. But there were so many things, and it became a problem. Once I removed some of them, it was kind of easier for her to be able to choose. And I really tried for her to choose her clothes for as long as possible. Now, some caregivers said that unfortunately, some of them would get into the cupboard and make a mess and pull clothes. So they had to lock the closet. If that's the situation for you, maybe it's a solution. And for some people, they really like the same clothes. They're comfortable in it. So it's okay to buy the same clothes for the person that wants to wear it every day. So at least you wash it and it's okay. And I guess I'm sure you're all aware that loose fitting, comfortable clothes is so important, especially for women. Stop with the bras if it's not necessary. Sport bras are great. And if they're comfortable not to wear a bra in the house, it's fine. Cotton socks, cotton underwear, sweatpants, shorts. I mean, anything with elastic waistband. Obviously, avoid girdles, control top pantyhose. Obviously, high heels, even though, I'm still wearing my high heels. So I have to watch out when I do. And tight socks. So you really want things that are comfy and easy. Use Velcro tape or large zipper pulls for clothing instead of buttons or buckles. You see them advertised. I don't know their name. These are slip-on shoes that you actually can slip on and slip out, or shoes with Velcro or with straps. So these are all really, and again, all it boils down to is giving yourself and them the time to do it and not to be rushing and to be as gentle as possible. So I'm going to open it up again for questions because we're talking now about dressing before I talk about oral care. So let's do that.
All right. If you're on the phone, press *6. Otherwise, those of you on Zoom, you know what to do, I'm sure. Okay. We had a chat back there, and we've got another one from Tamara. I think both of them were from her. Kizik is one slip. I've got to go to a different chat. Okay. Okay. Okay, her first comment was Tenna 123 is the dry cleaning we use. I imagine that was about your hair, to dry clean your hair. And Kizik is one slip-on brand. Skechers is another. Thank you for that. We love your hints and tips. Anybody else?
Thank you so much for that.
Yeah.
Any other tips that people have about, showers or sponge baths or dressing.
Do you think sometimes, Lucy, it's that they resist because of that intimacy? And I've been on the phone when people have said that they just don't feel comfortable bathing their husbands, when he's at end stage dementia. And I guess it seems to me that that's the time to think about getting someone else to do it.
Absolutely. I mean, it's a two-way street. Sometimes caregivers themselves, I've had sons, adult sons saying, I don't feel comfortable even being in the bathroom when my mother goes to the bathroom. And that's understandable. On the other hand, it's the person who's getting the care, especially in the early stages of dementia. That was a big issue with my mom. She was a very private person, old school. It's not something that she never exposed herself when I was a child. So even though I was her daughter. So these are things to take into consideration. If you're uncomfortable doing it, you don't need to do it. I'm giving you permission. You
Mm.
can find someone to come and do it for you, to support and help you. And some of the tips that I talked about, even putting a towel over a person really gives them a little bit intimacy. There's these big beach towels that we used to use with mom, So she was really covered in many ways. Big deal if the water went through the towel. So these are just little things that does keep that privacy. So it might sound like, oh, well, but it does work. You have to try what works for the person that you are caring for. So if it doesn't work, try something else.
Tamara added something to the TENA, TENA. She said it's a body cleaning product, not just for hair,
Yeah.
which is interesting.
Yes, thank you. And one of the things also, there are wipes now for adults that you can flush. Okay. They're like the baby wipes, but they're not. They're for adults and they're flushable. And so you can get them at any store, I think, that provides any sort of protections, things like that. So when we say sponge baths, these are very handy, easy things to take, especially when you're out and and the hands or the face, you just pull those out and it's done. All right, so I'm going to move to oral care, which is really, really important and many times very difficult to maintain. It really well to prevent tooth decay and gum disease, even if you don't have any teeth. Um, People don't realize that if your gums are inflamed and if your gums are infected, it goes through your bloodstream and could affect the rest of your body. So it's not just about where it's in the mouth, it's in your bloodstream. So it's really, really important not to ignore when gums are bleeding. It's a condition that needs to be taken care of. Poor dental health will also affect the individual's ability and wellness to eat. So they might not be able to tell you, I've got a toothache, and all of a sudden they don't want to eat, and you're having problems with that. So it's wise to have a complete dental examination early in the disease. Ask the dentist to schedule the appointment at times where there will be no delay on the office. Tell them, there's something, my husband, my wife, my sister, my brother, my partner has dementia, and let the staff know, even about certain behaviors. They might be scared. So let's look at some of the tips that might be useful. So it's really, it's important to remind the person to brush their teeth if possible. It may be easy for them. Now, some people really feel they like the electric toothbrush, only if it doesn't frighten the person. You have to try it out. It could be step-by-step instructions, trying hands-on, like guidance and gestures. You do it and they do it, show them how to do it. And try to be present when the person is there. You can't avoid it if they're going to start swallowing toothpaste or mouthwash or fluoride, but it's best to sort of coach them and tell them, take a sip of water and spit it out. Now, again, this is all little tips. And again, I keep reminding everyone, because I used to have to keep reminding myself, that I need to have patience. It all takes time. It's part of the daily routine. And what caregivers find very, very helpful is to have a daily routine. It's important to kind of schedule yourself because, as you see, there are so many things that need to be taken care of besides the fact of daily hygiene. There's meal preparations, there's shopping, there is appointments that you have to go to. So having a daily schedule is very, very helpful. Now, if we go to the next slide, there are a few other tips that are really good. There's fluoride swabs in the tooth if they refuse the toothbrush. Again, don't do anything without asking the doctor and the pharmacist. And there are regular fluoride treatments. Now, I don't know where you live. Where I live, there's fluoride in the water. For some, there isn't, but you don't do any of that before asking, because, you know, if they're taking medications, believe it or not, you have to ask the pharmacist. It could have effect. Now, we all know that if they have partial dentures, it's very important to keep them clean. Be prepared. The dentures are always an issue. They get lost somewhere. You know, try to put them in the same place at all times. And obviously put them overnight. And there are tablet solutions to clean them. And one of the things also, this was a tip from a caregiver. When you're dealing with dentures, make sure the toilet seat is closed, especially if the person you're caring for is there, and the drain is closed, because many times they land up in the toilet or being flushed down the toilet. Now, the person may have dry mouth because they're taking medications, and that happens a lot. And so they might be gesturing with their tongue and you don't know what it is that they're doing. Again, sugarless candies, but be careful with that. Why am I saying that? Or gum or ice chips, just make sure that they're able to swallow properly and they don't have any difficulties with swallowing. Okay, so I'm just looking at the time, so we do have some time. Let's open it up for questions or any tips. I love the tips about oral care or anything else that I've been talking about. So let's go.
Okay, folks, I've got my little website open. I can see if you open your line or you unzoom, diszoom or unzoom or whatever the word is. One thing I know that I've been reading about and I've noticed is that at least in urban areas, because, you know, I live in a big urban area and it's aging quickly, which most areas are, that they have these dentists' vans where they actually go out to the nursing homes. They have a ramp, people go up in their wheelchair and they get dental care in that van. And so if somebody is worried about not being able to get their person to the dentist, they might call their area agency on aging or their dental society and see if that's available to them, because it's really important to have that constant, you know, checkup.
Right. I cannot emphasize enough how important oral care is. And for those of you who are brushing your teeth, flossing is so, so important. Again, because if your gums are infected, I'm emphasizing and saying it, I'm going to repeat it. It goes into your bloodstream. It can really affect your heart as well. So it's a very important thing to have regular. So caregivers, you yourself, I hope that you're having general, going to the dentist every year and making sure that you're flossing and brushing your teeth.
Remember who's first.
Oh, I'm sorry.
Remember who's first. Number one.
Yes, number one, guys. Remember, there's two people in this relationship. One does not outweigh the other. You're as important to take care of your health, your mental and physical health, as you are about the person you're caring for. I'm going to talk about foot care because a lot of people don't think about it. Oh, so let's go to foot care. So as we all age, foot care is often neglected because people can no longer reach their feet comfortably. I can understand that. And they, you know, and they often don't see to provide proper nail care. this task can be more of a challenge if the person has dementia, I have to tell you. So let's look at that, okay? Now, it's so important to check the feet on a regular basis. Let me just tell you something about nails, whether it's your toes or your hands. Your nails give you a clue about what's going on in your body by the color. So if you're noticing that all of a sudden their toes look kind of bluish or yellowish or any other color, something is going on in there and it needs to be taken care of, especially also with the nails. So as I said, look for discoloration. It could be a sign of poor circulation or other things. And calluses, bunions, cause foot pain, and they might not be able to tell you. So maybe you haven't looked at their feet for a while. All of a sudden you're looking at their feet and you say, oh, something doesn't look right here. They need to go see the doctor. Now the length of nails really has, if you don't cut your nails and you're wearing shoes, all of a sudden it becomes tight and it can hurt. Now be careful of nail clippers and scissors. If you're uncomfortable trimming nails, have someone else do it. There are foot clinics. There's also, you can call your area on aging to see if maybe a nurse can come in or someone to take a look at that, or have a professional person doing it. I was not comfortable doing my mother's nails, I can tell you that. And she loved having a little pedicure, so it was worthwhile my way to have someone come in, and as you could see, a little nail polish often brings a smile. And that's true. And if you've heard me before, I always tell the story. One of my most memorable moments with my mom was when I did her nails. I used to bring different colors. She would choose the color she wanted. And for that period of time, we were connected in a different way. I wasn't caregiving to her. She was my mom, and we were talking and reminiscing and things like that. So remember that foot care is really, really important. Now, again, for a very short period, since people are not asking that many questions, we're going to go to hair care, and then I'll open it up for questions. But before I do that, is there someone who wants to ask a question about foot care or make a suggestion?
Jennifer sent a chat. I think my dad knows he gets so tired because he feels like it takes him so long to shower. It's like a big project. I believe he feels overwhelmed. He does shower for himself. Any ideas to help him?
Well, your father's absolutely right. It probably is very tiring. I guess if he's doing his own showers, do you think that maybe does he need assistance? I think that if at all possible, maybe he can have a professional come in and sort of assess the situation now. Remember that dementia is progressive. So what they were able, let's say, to do a day ago, all of a sudden, it's not the same anymore. So maybe he needs an evaluation at home to see what other aids he might need to make things a little bit easier for him. Thank you for the question. Now, I'm jumping around because you think, well, you're taking a shower, why aren't you doing your hair? But sometimes doing hair, washing hair becomes a problem, so you kind of leave it alone. So let's look at hair. Clean, well-groomed hair will make any person, not only with dementia, feel better about themselves, Now, why am I talking about this? Because sometimes what happens is because, I have longer hair, whatever. Choose a hairstyle that's easy to care for, but please don't chop off their hair completely. Ask them if, what would they like, show pictures or things like that. Now, the other thing is very much like brushing your teeth. And again, engage the person to comb their own hair. And you need to be there to kind of show them, do them at the same time. And it's a little bit repetitious, but use non-stinging baby shampoo, dry shampoo, we talked about that. But what I wanted a little bit emphasize is, a scalp massage when washing may be very, very soothing. So these are little tips. Why am I saying that? Because if they're becoming restless, you want to distract them. And one way to distract them possibly is say, going to give you a massage. And then once you get your hand in there, it feels so good. And I guarantee you the person is going to, the agitation may stop. It's just a little tip. Doesn't always work. Now, if it becomes really difficult to take care of their hair, maybe it's time to go to a barber shop or to a hairstylist. And again, call ahead of time, make appointments when they're not busy, explain to the hairdresser or the hairstylist, the barber shop, that's the person you're caring for has a bit of a difficulty, and stick around and be there with them. I wouldn't leave someone with dementia alone, because you never know what the reactions will be. I saw something on the chat, Evelyn. Did I see
Yeah, we've
something?
got a couple.
Yeah, let's go for it.
Jennifer, who's the one who talked about her dad having a tough time, with having enough energy to shower. She said it will be 2 to 3 weeks by the time I convince him to shower.
Yeah.
Would you like to respond to that? Kimberly did say shower chairs are wonderful,
Yes.
and that'll save some energy. What
Yes.
else?
Back to Jennifer. I mean, this is a problem. Your dad is not the only one. I hear it time and time again. It's not only, it could be that the person is tired. I'm not saying that the person is not, but it's important to know what stage of dementia your father is in. Is it because cognitively he's just doesn't know what he needs to do and it appears, or he'll say, I'm tired, because many times people have very good social graces. They cover up a lot of the dementia and what's going on. So when I said about having him assessed, it's important to have him assessed to just see maybe what's going on. When was the last time that he went to see the doctor, or be assessed for his cognitive abilities, or be assessed for what the needs are there. So it's kind of, I know that with my own personal experience, I had to take, things changed rapidly with my mom at the end. It was almost like periodically I could see things that she was able to do. As I said, it seemed only a week ago she was doing it. And now she wasn't able to do it. And she covered up very well. She really did. So I used to take her to the memory clinic, and there are memory clinics all over, which in your community you can find out. To have her assessed, I think I used to have her assessed at least once a year, if not twice a year, just to see her baseline. Where is she at? What were my expectations too high of her? Was I expecting too much?
Mm.
Okay.
Minerva had a comment using washcloths can be useful, and maybe then you can
Using what? I'm sorry, I missed that.
using washcloths can
Yes,
be
of course.
and
Yes.
maybe do one part of the body one day and another part the next day and so
Yeah.
on. And I hope Jennifer can jump online, because she sent us a chat saying that they have a safe bathtub. What is that, Jennifer?
I would think that, Jennifer, I'm waiting for you. I think a safe bathtub means that there are safety things in the bathtub, possibly, like a shower
Well, you can
chair.
walk in.
You're talking a walk-in. Oh,
Yeah,
yes, I see them advertised on television. Yes,
I
yes.
imagine they're quite expensive, but
Yes,
my brother-in-law had one, and
uh,
he really enjoyed it.
even
But he
that's
didn't want to
overwhelming.
buy it, so like bath. So that's an idea if you have the extra money.
All
Well,
right.
yes. Well, we had it
No, I
from
think that's important if you have the extra money. I'm
we
just,
had
thank you for,
we
yes,
had we had it for my mom. I didn't realize I could talk. I was typing and I typed slow.
yes.
We had it for my mom who couldn't really lift her feet towards the end, and so it's here. But yes, they had to finance it, and it is very expensive. I mean, he said it was very expensive, but it
Yeah,
did help my mom until she couldn't lift her feet at all by
yeah,
herself. Yeah, well, I mean, she could
yeah,
still barely get in it, but and
yeah.
there are different. Also, I never knew this, but they said there's different heights, even though it's a safety tub and you can just almost slide in it. There are different heights, and that's very important. They didn't get explained that. And so at the bottom where you can lift your feet. So, but yes, I think he never really smells. There's one time when I noticed he smelled, and and I never thought about asking him a little more in detail, because even though he has a lot of problems remembering, he still takes care of his teeth. But just getting in that bathtub is so, or the shower, that he must clean up some, because like I said, he never smells. He does put on deodorant. Few times he's started to wear cologne, then I don't know where that came from, but that got, I don't want him to cover up, because he doesn't smell, and sometimes those real strong colognes, I'm thinking, I don't know where he had that, but
It's so interesting what you're saying about cologne. I don't have the time to go in it, but I talk about that sometimes continuing even makeup. My mom loved to wear a little bit of makeup. And if we can, and cologne, if men were used to having cologne, there's nothing wrong with doing that. But I thank you for that. I'm looking at the time, but I do have a few things that I do want to say, even though I can't get into the specific of putting makeup and cologne on. Again, it's really important when you're dealing with hygiene, establish a routine, keeping it simple and as pleasant as possible. You will have a better chance at getting through it with humor and TLC, tender loving care, dignity, respect, rather than anger, frustration, yelling, or just giving up. Don't give up. Try and see through their lens. This means don't expect your reasoning to matter. Just take a deep breath, smile, and try again later. If it never seems to work out, you might want to consider a home help if that is possible for you. But I also want to tell you that, I always tell caregivers that you need to take care for yourself. It's very important for your mental and physical well-being. We all need balance in our lives to reduce our stress, by exercising, eating well, sleeping, taking deep breaths, staying connected with others, and not isolating yourselves. And don't forget to pour yourself a nice bubble bath and soak some of that caregiver stress away. Do something that you really, really enjoy. It doesn't have to be a bubble bath. If things get too difficult, make an appointment with the person's doctor. There may be a reason why the person is behaving in this manner. They may have a urinary tract infection, their medications need to be changed, or their dementia has progressed. Please keep in mind that if the person you are caring for has become verbally and physically or sexually aggressive, you need to put a plan in place. This can happen. Make sure you call a family member or a trusted friend to assist you. If the person cannot be controlled, you may need to call 911. There are many resources in your community to support both of you. Please reach out. And again, you don't need to do it alone. Minerva, if you can quickly go through the slides, because I'd like to show the resources. And, I was going to talk about tips for women, for men, the hygiene, just establishing exactly what I said. And there are many resources out there. I also want to give Evelyn a chance to do her little blurb, but maybe if we can take a minute, if there are any questions, I would be happy to answer them.
Jennifer, do you still have a question?
Yes. What was the memory assessment that you were talking about, other than just going to the doctor and they just want, they want the neurologist to do everything. But so what is this memory?
Well, I don't want to give false information, because I live in Canada, in Montreal. Every hospital has a memory clinic.
Okay.
That the referring doctor can refer. I think you should ask the doctor. I would be very surprised if there aren't any. Maybe they call them something different in the United States. Okay. But there definitely are. And what I mean by memory clinic is they do the mini mental test and other tests to gauge where the person is at, and then they're referred to the doctor, whether it's a neurologist, whether it's a psychiatrist, regarding medications. So I am sure that there might be. Evelyn, do you know what they're called possibly different?
Thank you.
You're very welcome.
I don't know of any memory clinics. Generally, your doctor would make a referral to a neurologist here. But
That's what we've had. Yeah.
Yeah. I want people to know, number one, that you can't do it 24/7. There may be a time when you need to do placement, because it's really important not to feel like you need to do it. You're the only one who can do it, and you're killing yourself doing it. We don't want you can't do that. And your loved one wouldn't want you to do that if they were in their right mind. Number two, Medicare actually pays for someone to come into your home and do a total assessment of your home, of the adaptive equipment that may help your loved one be more self-independent, be more, take better care of themselves in the shower, on the toilet, in the kitchen. And the doctor, you have to just ask your primary care doctor. They can make a referral for an occupational therapist or a physical therapist. And both of those people, those experts can really help out in terms of helping people stay home a little bit longer, helping you out as the caregiver to not, do such a hard job, when there are adaptations to help you out. Also, I want to give you all the elder care locator number for any resources you might need, because we've talked about a lot of stuff that might help you here. And the way to find it is either to go on eldercare.acl.gov. That's a website. You put in your zip code and it will give you your local area agency on aging or any service that you want. You can put in at-home dentistry, for persons with dementia or whatever it is that you need. They also have a phone number during the week. There's live bodies on that phone. That number is 800-677-1116. That's 800-677-1116. It's a federal program funded through the Administration on Aging, and they've got everybody's computers from the area agencies on aging, the 650 of them across the country, and they have so much information there. And with that, let me tell you what's coming up. We've got a good calendar for this month. Next week, Monday the 13th, Essential Conversations, helping older adults share their wishes for care through the end of life. And this is by the Conversation Project. I actually facilitated a session, I think last year. And I downloaded stuff from the Conversation Project and gave it to my kids after I filled it out, telling them what I wanted. And they both read it and they both looked at me and go like, "You're not dying." I'm like, "Hey, I will. I am. We're all in the process of dying." So it was good to get the conversation started. So it's a good place to start. And then on the 21st, next Tuesday of May, Mindfulness for Caregivers Stress Reduction with Cynthia Hazel. Mindfulness is, you hear the word all the time, and I think a lot of times we skip over it. But if you really think about it on a daily basis, you can reduce your stress so much. I know I've been studying it. On Wednesday, the 22nd, we have a total Spanish presentation. To practice good health in your life is for self-preservation as a caregiver. So if you speak Spanish, you're going to love that one. On Tuesday, May 28th, we have frontotemporal degeneration, what it is, what it isn't, and what are the signs and symptoms. So got some good ones coming up. I want to thank you, Lucy, for doing such a great job. You always cover so many good things. People always have good, input and questions for you, and you do a lot of research, and thank you very much. I want to thank all of our participants today for your tips, for your questions, for your comments. It really makes our podcast so much more interesting because nobody can help a caregiver like another caregiver. So thank you so much. Really appreciate that.
I want to thank all the caregivers for all the work that you do. Take care of you.
Every day, yes. I also want to thank the WillMed Charitable Foundation for the incredible support, for Minerva, for scheduling these things, which isn't easy because they get all these wonderful professionals, to do these presentations on topics that are so important to us. And just for all of the fundraising, the hard work that they do to really support caregivers in this country. So thank you all so very much. I'm going to end the recording. Lucy, are you staying on?
No.
Oh, okay. All right. So I'm going to end the recording, and I want to thank you all so much and hope to hear from you again soon.
Thank you, everybody. Bye-bye.
Bye-bye now.